Hello, my name is Professor Guido Pialis. I'm a sports cardiologist and I work here at the Institute of Sport, Exercise and Health in London. And here are my top tips for Corona and the heart. Firstly, and this is probably the most important information here, is that COVID involvement regarding the heart is very rare. Your heart, as you know, is the most important organ in your body, and that's why your body protects it. So there does not need to be a fear that the majority of corona infections affects the heart. And how to protect your heart is of course clear. Healthy diet, exercise, alcohol moderation, no nicotine, and a life outdoors certainly helps. What if you do get COVID? Is there any risk for the heart in the immediate phase? Well, here I would actually warn, yes, in the immediate phase, protect your heart by not doing any strenuous exercise. And in this phase, ambition is not your friend. Stay at home, stretch, relax, but don't do any strenuous aerobic or high intensity exercise during the first week, the first 14 days you've contracted a corona infection. If then your symptoms have subsided, you should still wait 7 days and then you can start doing your exercise regimen again or take up some new exercise. You should then again not do anything too strenuous, too much, but give yourself a couple of weeks to start with mild, moderate, and then more intense exercise. Very importantly, of course, what to do if you do have a corona infection. In the acute phase, you do not need to have your heart checked out unless you've got symptoms. What are the symptoms? Symptoms are chest pain, shortness of breath, that is moderate or severe, chest pain, particularly during activity, also palpitations, the sensation of a fast heartbeat, and dizziness, or indeed, which is very rare and hopefully should not happen, as syncope, faints, or collapse. Then you should see your GP first, and you might need to have a referral to the cardiologist, and we are one of the specialist centers here in London who see a lot of athletes, but also the general population for investigations regarding heart and corona. What we would suggest needs to be done: an electrical trace of the heart called an electrocardiogram, an ECG should be done, an ultrasound of the heart called an echocardiogram should be done as well. And because it is most important to check that your heart is performing well during exercise, we would also do exercise imaging and some arrhythmia monitoring at home with mobile ECG devices. And my final advice would be, of course, be positive. If your symptoms have subsided, then please join an active lifestyle again. And we also know that there are, in very few cases, long-term damage to the heart from corona. So the risk is relatively low, and if recognized and treated well, you can regain your life as it was before. Thank you very much.